On entering the African Union Commission compound, all delegates will have to pass through here. A delegate's sample is taken here daily and COVID-19 rapid test done. Results are given after 15 minutes. And if you get this yellow card written cleared, then that means you're permitted to access the meeting halls section. Africa CDC Director Dr. John Nkengasong says these and other measures are vital to prevent the transmission of the virus in the meeting.
We agreed that because of the Omicron, the speed at which, the rate at which it spread, we should make sure that we use the N95 mask. And that's why you see everybody around here is wearing the N95 mask. Then we also agreed that, or advised that we should have a reduced delegation so that you don't have a large number of people coming in there. And while inside this compound, we should have, inside the hall, we should have social distancing. That's a set of measures that we've put in place, and we are very pleased to report that these measures are actually working well, because the testing yesterday and today show very limited positive cases.
The Continental Health Agency hopes that African leaders will agree to strengthening its role further. Dr. Nkengasong says leaders should also discuss how to boost COVID-19 vaccination.
If you recall, our vaccination rate is still very limited, around 11% coverage. We hope that they will discuss the need to increase political commitment and political will to ramp up the vaccination. The situation last year and this year has changed. We are in a situation where this year where many more vaccines are coming onto the continent, and we should now be focusing on the vaccination. How do we get vaccines from the airport to arms of the people? And we need strong political leadership of the head of states, as they have done all through this pandemic.
The Africa CDC leadership also hopes that head of states discussions will focus on the need for local vaccine manufacturing.
We cannot ignore the lessons we've learned from this pandemic, which is that if you do not produce your own vaccines, you'll be left behind. If you do not produce your own diagnostics, you'll be left behind. So as we speak, I'm very encouraged that the Africa CDC launched a partnership for African vaccine manufacturing, and it has galvanized the continent, and about 10 countries have now embarked on the journey to producing vaccines, including South Africa, Rwanda, Senegal, Morocco.
South Africa is taking the lead on the African Union's COVID-19 pandemic response. President Cyril Ramaphosa is due to deliver a report to his fellow leaders on COVID-19 in Africa and progress in fighting the disease. Coletta Wanjohi, SABC News, Addis Ababa, Ethiopia.